All right, let's continue going on. I'm afraid with today's show, I'm not going to impress Mimi or Richard. Now, this is the effect of homocysteine lowering on mortality and vascular disease in advanced chronic kidney disease. My bet is, I haven't looked at this, my bet is it'll say it doesn't do any good. And the reason is, there have already been a bunch of articles out that said it didn't do much good. Treatment with high dose of folic acid and B vitamins did not improve survival or reduce the incidence of vascular disease in patients with advanced chronic kidney disease or end-stage kidney disease. Okay, so it does. I don't have time to look through this to see whether or not they got the homocysteine down, but I think that it did. How do I know when something is the real deal rather than just one article? Like I just said, I've read several other articles that have said exactly the same thing. So this is a rehash. Not a rehash, this is a randomized controlled trial. So they worked very hard to prove the point one way or another whether what I had learned previously was actually okay and the truth. Now when was the, this just turned up. I may have seen this. This is September 12, 2007. This talks about carvedilol, which is Coreg, for children and adolescents with heart failure. And basically it says it's helpful, because I remember reading that. And it is helpful for people, children and adults with heart failure. There is a new drug on the market, which I'm rather impressed with, which I have had the opportunity, and I consider it a privilege to speak on the behalf of, and it's called Bistolic. Right now I'm one of those physicians that a lot of people would say, oh, he's taking payola. Look, I prepare very hard. I deliver a great deal of information, not just about the drug, but about the reduction and prevention of all cardiovascular disease when I go out to talk. I talk about the virtual preventability and how to do that with nutrition and exercise and percent body fat, and then eventually I discuss the medication that's involved, compare it to the other medications on the market, and give it an upsign if I believe it. However, I will say this, I wouldn't be speaking for it if I didn't believe it, so that's why I speak on the behalf of certain medications. I've had experience with these things. I know them to be effective, and I believe them. No medicine is perfect. All medicines have downsides. Remember my third of the 10 health commandments. All drugs are poison, including the ones I prescribe, including vitamins, minerals, herbs, and supplements. Be well, use as few as possible. And now we're back to my aphorism in the book, and that is where I talk about Wednesday and the weekend off for supplements, not for prescription medications. They have to be taken on an everyday basis, almost always. But this is for any supplement. I recommend 4 days on and 3 days off, or if you really feel that's not quite enough, then have 4 days on 1 week and 5 days on the next week, and that way it's sort of between 4 and 5 days, which is what I think is correct. Now, pioglitazone and the risk of cardiovascular disease and type 2 diabetes, pioglitazone is Actos. The medication that I do recommend is associated with significantly lower risk of death, heart attack, and stroke among a diverse population. Serious heart failure is increased. Yes, you have to watch out because there are downsides to every medication. There is not a medication that I have written a prescription for that does not have a downside in some people. Obviously, not in most people. Not everybody who goes on Actos develops heart failure or collects fluid. Some do and some don't. And you have to understand the concept of cost and benefit. And what I mean by that is, what is the overall benefit and what is the downside? And what's the balance between the two? And the balance between the two is, in my mind, that when you use the diabetic medication Actos, a TZD, that's the family of class of drug that it is, it's a TZD, thiazolidine dione or something like that. Sorry to sound like such a farmer. Thiazolidine diones. I said it correct. Well, anyhow. So that's a pretty tough one to say. And I think most people who lecture on that talk about it being a TZD rather than trying to say it. It is a PPAR gamma inhibitor, and PPAR gamma is involved in inflammation. So it has even been studied in conditions like Crohn's disease. I saw a new patient today. Today is March 11, 2008. of a woman who had had sarcoid, who now is a smoker. She's a little bit overweight. She has normal blood pressure, and she also has Crohn's disease. And she put herself on psyllium and bentonite. The psyllium helped regulate her bowels, and the bentonite she thought was causing cramps, and she got uncomfortable while she was in my office as a new patient. So she intends to stop the bentonite, which I think is a good idea. And I started to put her on a very minimally allergenic diet, no wheat, no dairy, no soy, everything cooked soft and warm. She was to take probiotics. She was to stop her digestive enzymes because enzymes sort of chew things up, and I don't want her things chewed up. I want them to calm down. Long term, okay, enough of that. This whole thing must be on the TZDs. Polypharmacy and drug interactions, okay. And here's limitations of applying summary results of clinical trials to individual patients. And of course, that is always difficult. Well, so much for that.